that categorization.
Doctoral researcher Nicholas Coombs was on staff at a clinic in Billings when a 17-year-old was admitted in a severe depressive state.
He was checked out. He was ready to call it quits. So the psychiatrist and nurses on staff didn't know how to approach the situation.
Coombs knew there was more to be done, so he's working with the Montana Suicide Project.
The passion entailed with how prevalent these issues are, especially in Montana, and I mean all around the country, all around the world. It struck a nerve.
The Montana Suicide Project analyzes Montana-specific data about suicide to find preventative measures. Research assistant in the School of Social Work, Kim Spurzum, says they hope to affect change at a higher level.
I also spent the last 7 years traveling around the state working with young people and administrators in schools and really seeing the health disparities that exist in our state.
The state allocated $1 million to evidence-based research for suicide. Coombs says mental health care doesn't receive the funding it needs because each person is different.
These issues are very complicated. They're not black and white, and depending on different populations, different factors, it can completely change the conversation. So there's no universal approach.
Coombs and Spurzum have already started mapping out the data and finding the programs that are currently in place across Montana. For UM News, I'm Meri DeMarois.
And I don't know whether